artery and the vertebral artery. So paired internal carotid arteries and vertebral arteries are giving the main supply to the brain, and they are connected at the base of the brain via their branches, and they are making a circle of Willis. Is it okay, beta? Can you hear me?
Yes, ma'am.
Yes, ma'am.
Okay, should I continue?
Yes, ma'am.
Yes.
Okay, so internal carotid artery, and you may know that this is a branch of common carotid artery. Common carotid artery is having two terminal branches, external and internal carotid artery. So the internal carotid artery is taking the main blood supply to the brain. So this is a branch of common carotid artery ascending up in the neck, okay, and reaching the base of his skull and entering the cranial cavity via carotid canal present in the base of the skull. So after entering from the carotid canal into the cranial cavity, it runs upward and forward towards the cavernous sinus. Here we are having the cavernous sinus. So this is the direction of the artery, and then it is running towards the cavernous sinus, emerging from the cavernous sinus at the medial end of the anterior clinoid processes. At the base of his skull in the cilia cervica, we are having the anterior, middle, and the posterior clinoid processes. So it is emerging from the medial portion of the anterior clinoid processes, and then it is going upward and then posteriorly. Then it is turning towards posterior aspect. And then it is here divided into its terminal branches, which are the anterior and the middle cerebral artery. This one, if you see, this is the anterior cerebral artery and this is the middle cerebral artery. So these are the terminal branches of the internal carotid artery. So this was just a review of the course. Now, during its course, the internal carotid artery is giving branches. So the first branch is the ophthalmic artery, which is arising as it is emerging from the cavernous sinus. जैसे ही वो cavernous sinus से निकलती है, on the anterior aspect it is giving a branch called ophthalmic artery, which is entering the orbital cavity via optic canal. There is an optic canal into the orbital cavity. Through this optic canal, the ophthalmic artery is entering into the orbital cavity and supplying these structures. Then it is giving two other small branches, which are the choroidal artery and the posterior communicating artery. So before the termination of internal carotid artery, there is a small artery which is emerging. This is the posterior communicating artery, which is running posteriorly, going posteriorly and anastomosing with the posterior cerebral artery. So posterior communicating artery is a branch of internal carotid artery, which is going posteriorly and anastomosing with the posterior cerebral artery. Then there is another small artery called choroidal artery, which is running with the inferior horn of the lateral ventricle. In each cerebral hemisphere, we are having lateral ventricle, which is having anterior, superior, and inferior horns. So along the inferior horn, this choroidal artery is running and supplying the choroid plexus. So these are the three branches before its termination, and the two terminal branches are the anterior cerebral artery and the anterior cerebral, this one, and the middle cerebral artery. So if we go to this image, this is the base of brain. So this is internal carotid artery. It is giving a branch called posterior communicating artery, which you can see this is going posteriorly. And then it is giving branch called anterior cerebral artery, which is running anteriorly. So this is the course of anterior cerebral artery emerging from this, going anteriorly and medially towards this midline median longitudinal fissure. So this is going to this fissure, running medially, and here this anterior cerebral artery, I'm talking about anterior cerebral artery. This anterior cerebral artery is going anteriorly, medially towards the median fissure, and then it is anastomosing with opposite anterior cerebral artery via anterior communicating artery. So here we are having anterior communicating artery, which is making an anastomosis between the two anterior cerebral artery. So this is anterior cerebral artery. Now here, this is the middle cerebral artery. Middle cerebral artery is arising from internal carotid artery, and then it is running laterally towards lateral sulcus. Here you can see. So if we go to the next slide, next image, if you can see here, this is a small choroidal branch from the internal carotid artery going to the choroid plexus. And then this is the middle cerebral artery going towards lateral sulcus. And here, if you see this image, so this is the middle cerebral artery going towards the lateral sulcus. So this is middle cerebral artery. Then blood supply of the anterior and middle cerebral artery is more important. So going to this image, if you see this image, this is the anterior cerebral artery. Anterior cerebral artery was going medially along the median fissure, and then it is running anteriorly over the corpus callosum and then going backward. So it is running along with the corpus callosum. This is going backward here over the corpus callosum. So during this, it is giving cortical branches to the medial cortex of the cerebrum, medial cerebral cortex, medial side of the cerebral cortex. So this whole is supplied by the anterior cerebral artery up to the parieto-occipital sulcus. Along with this, it is also supplying the late 1-inch portion of the lateral surface. So this is lateral surface and this is medial surface. And the blue color is showing the blood supply by the anterior cerebral artery. So the blue color